Today, I just want to talk to you about thoracic back pain or upper back pain. If you were to put a point at the lower part of your neck and another point just above your butt in the middle, and you join the two lines, the 2 points, and then you transect that line that you get halfway, the bit above that line is the thoracic area or the upper back. There are various causes of pain in this area. There can be pain as a consequence of intrathoracic structures such as the heart or the aorta, but we're going to leave those out. There can be pain as a consequence of the chest wall. That's what we're going to concentrate on. Before proceeding, let me say that I'm going to exclude dangerous causes of back problem because that is not what I'm interested in today. The kind of thing we're talking about, cancers of the thoracic spine, infection in the thoracic spine, osteomyelitis. You can get fractures of the thoracic spine. So we're not going to talk about it. I'm not referring to that in this particular discussion. I'm talking about the pain coming from the soft tissues of the back. The kind of soft tissue we're talking about here are the ligaments and the spine, the thoracic spine, all the way from the top to the bottom. We're talking about the muscles in the upper back, and the muscles are the trapezius muscle. Below that, over the shoulders, you got the supraspinatus muscle and the infraspinatus muscle. And then on either side of the spine are the rhomboid muscles. You also have a muscle called the latissimus dorsi on each side of the thoracic wall. You can get pain in this because there's been a strain or just an acute injury. The kind of thing that I'm talking about here is that you can have a sudden sprain or a strain, as in a car accident, because you pull the muscle, or you have been sitting too long or standing in a slouched position, or you've been carrying something on your back, such as a backpack. You can get it as a consequence of sitting too long on the computer, particularly if you're using a laptop. It can be because the muscles are just too weak. If you're a slouched potato, the muscle could go into spasm, trying to prevent them from tearing. They think they're going to tear, so they go into spasm to give you pain, so you don't make too much movement. You can get the back problem as a consequence of repetitive activities, as in doing some form of sport or work. How tlhagola thata ko o tlhola o tlhagola tsatsi le lotlhela e ka nna re o tsoga o itlhela e le gore o na le botlhoko gone in this area of your body. Now, normally when you have the pain in acute phase, it's really easy to treat. The doctor will give you some painkillers, and the doctor may refer you for physiotherapy. But sometimes these do not work. When you have persistent back pain, it can be quite disabling. And because you've seen physiotherapists, you've seen several doctors, and it's not helpful, it can be quite make you very unhappy, and you could even go into the depression. It can be very disconcerting. That's why a specialist comes into place, because a specialist has been taught how to systematically go through the various tissues that can be responsible for the back pain. And once they got what the cause of the back pain is or the structures involved, they can institute a treatment. Other symptoms that individuals can have are allodynia, hyperalgesia, and sympathetic dystrophy. But those are beyond the scope of this discussion. Now, one of the things that has to be addressed is the reason why you are getting this back problem. You could have some muscle imbalance. You could have a job that is causing the back problem. One of the things that I often do is to go to your workplace to see how you're working. And then we can modify your work station such that it's more suitable for you. A science called ergonomics. If you are working for too long on a computer, normally advise individuals to stand up after about 30 to 45 minutes, to stretch out. That resets your spine, your spinal muscles, your back muscles, so that they can hold you in position and don't go into strain. Yeah, so if you have a chronic back problem, which can be quite disconcerting because it's very, very painful, you can just give me a call and we'll see what you can do. Enjoy yourself.